Hello, this is Dr. Hansen, Carl Hansen again. This is going to be talk entitled Healthshares versus Health Insurance, Part 1. This is for individuals. Part 2 will be for employers, and we'll do that in a bit. So, some myths to dispel. The first myth is that healthcare costs are high in the United States. Well, that's not true. Healthcare charges are high in the United States. Healthcare costs have a certain base rate, and then facilities, other entities, health insurers, they jack up the costs of many things and in the form of high charges. So just understand the difference that all these charges you see in the healthcare industry do not really reflect costs at all. The second item is that the only way to cover yourself for catastrophic illness is to get a good health insurance. Totally wrong. There is an option that I'm covering specifically today that takes the place of health insurance. So we want to listen to that. The third issue is that I need health coverage to cover all my medical expenses. If you buy into that, then you're kind of going down the wrong hole. We need health coverage to cover catastrophic or big ticket items, not catastrophic necessarily, but not for your day-to-day healthcare expenditures. That do not need a coverage or an insurance of any type to cover that, because if you have a good budgeting system for your home, you in general can have a neat little bit of money to cover the cash price for some healthcare expenses, whether that's over-the-counter medicines, etc., or doctor visits. So the fourth thing is that everybody needs health insurance, that we need to have everybody in the United States covered with health insurance. That's a myth. If you're 25 years old and you don't smoke, you don't drink, you don't do drugs, you have a good diet, you get some exercise, the chance that a 25-year-old person is going to need any healthcare insurance or coverage at all is extremely low. And so taking out a policy is really a risk thing. You know, most of us have automobile policies, but we've never actually had to use it. Most of us have health insurance policies, and we really haven't had to use them, which is good, but that just underscores the myth that everybody in the United States needs health insurance, and that should be dispelled with. The fifth myth is that, if I'm keeping track correctly, that health insurance equals health care. Of course, it doesn't. We know a lot of people that don't get good access to health care, even though they have some sort of policy. And lastly, I do have many patients that of mine in my direct primary practice who do not have any health insurance or health coverage whatsoever. Their membership with me as their primary care physician is what they get, and the rest they have to handle by cash. However, I do recommend that people look into getting some sort of healthcare coverage for some of the more expensive items. It just so happens that what I recommend is a health share, not a health insurance, and that's what we'll be covering today. And we'll try to make this succinct. A health share is similar to health insurance in that you pay a monthly payment into this entity. The difference is that a health share is much less expensive than a health insurance premium. A health share similarly shares something that the insurance industry calls a deductible, where as a member of a health share, you pay a certain amount, up to a certain amount of your own cash for healthcare expenses, and then after that amount is reached, then whatever healthcare expenses come after that starts to be covered by another entity. The major difference between the two is that the health share is much less expensive, that monthly payment. It also is paying into you're part of a community of people, patients, paying into this larger community, this pool. As a consumer, if you will, a patient, you actually look for the lowest cash price available. So if you need a knee replacement, you'll check with one facility and they may charge $16,000. Another facility might charge $40,000. So what you do is you say, okay, I've seen the orthopedist or my physician on multiple occasions and I've paid them cash. But now it's time for a big ticket item. big for the surgery. Well, obviously what you do is you go to the lesser expensive facility that covers a knee replacement. That exercise is aided by your Healthshare entity that you join. Their responsibility to the Healthshare community is that we want people to find the cheapest places to provide these services, and that'll help you out as the patient, and that helps the entire community that pours into these funds. So it is different in philosophy. Some argue, or ask rather, that these entities, these health shares, well, they're not regulated, et cetera. They're not government regulated. They're not overseen. Well, we've seen the health insurance industry. They're regulated and they're overseen, but you see how confiscatory they get and how wasteful they are and how much profit they make. I think United had $80 billion in profit the previous year. So just because these industries are regulated, remember, they're regulated by the fox guarding the hen house. They're overseen by industry that they essentially fund mostly, as far as putting money in the pockets of legislators, et cetera. So it's not a healthy relationship. So to join a Healthshare is going to want you to attest to a few things. One is they're going to ask that you do not smoke. If you do smoke, you may have to pay a little more into the monthly amount, or you'll have to have an adjustment in your initial payment amount, the equivalent of a deductible. They're going to, some of them are going to want you to test to whether or not you're Christian or even Jewish. Most of them I know do not, but they want you to agree, at least in principle, to do things that are where you have skin in the game, where you're doing things to take care of yourself, that you're not mistreating your own body. They also want you to agree that you are going to, when you go see a physician or facility, you tell that facility, I do not have insurance. Because in fact, you don't. You tell them, I am going to pay you cash. And from then on, you just get the cash price from that particular physician you're seeing, et cetera. But you do not, in fact, have insurance at this point. However, the track record on these health shares is excellent. They, in fact, do pay their obligations when it comes to big ticket healthcare expenses. I would also say, though, you have to know Healthshare has a waiting period for certain conditions. So if you just got diagnosed with a severe illness or something, or even, let's say, a cancer, and you decide on the next day or the next month you're going to join a Healthshare, there's going to be a waiting period. That says, well, we're not going to immediately cover. We'll cover you for everything else, but anything associated with that pre-existing, we are going to have a waiting period before we start to cover that. Now, that typically doesn't account for stuff like high blood pressure, diabetes, et cetera. If you have that and you sign up with a Healthshare, they're going to cover that. But it's certain particular things, and each Healthshare spells out in their member guidelines exactly what they cover, what their healthcare waiting period is, et cetera. But they don't cover, Healthshare doesn't cover all the Affordable Care mandate the medical insurance industry wants to cover. So it covers the basic stuff that you need as a typical patient to what you want covered. So a Healthshare is an excellent option for somebody who does not currently have health coverage, or somebody who does have health coverage through one of the expensive agencies, Blue Cross, United, Cigna, Aetna, Humana. If you have expensive coverage through that as an individual, I recommend heartily that you investigate these health shares. Now, what health shares do I go to? Well, I don't want this to be an endorsement. I do belong to one myself. I pay into one. I will list these in the notes below. And this is probably not an all-inclusive list. This is the list of health shares that I know of. I purposely am not ranking them in order of my favorite because I don't want to imply that. They all have their attributes and you want to read through those. But be it known that it is way cheaper than insurance. So I recommend if you're a patient, even if you're healthy, that you do consider looking to purchasing a health share. It is ethically and philosophically way above the typical insurance industry. The typical insurance industry wants healthcare costs to be high. The health shares want healthcare costs to be low. Quantum leap, quantum difference in philosophy there. So I hope this helps. Hope you got some information out of this. If you're insured or if you're not insured, please check out these items. Obviously, if you already have Medicaid or Medicare, then you're covered through the government or some organization. So this may not apply to you. And our next episode, I'll be talking specifically to employers about what they could look at to save money for their own company. All right. I hope this helps, and you take care. Bye-bye.